and that's why I got the face. But take a look at me now.
All right, hello everybody. This is Brice Hancock from Mile High Continuing Care and Mile High Sober Living.
One of the great challenges is knowing enough about a subject.
Brice, what are you doing over there?
Struggling. All right, so I'm here with Sarah Zubrin, the Chief Clinical Officer from Mile High, Jill Johanningmeier, the Program Director from Mile High, and Jordan Hamilton, CEO from Choice House Outlook up in Boulder. We are here to discuss some challenges and solutions for what we're doing during the pandemic involving sober living and sober living involved with treatment or just standalone sober living. So I think I want to start with Sarah. Do you want to talk a little bit about the CDC guidelines, what we're doing, how we're treating the clients and helping them stay safe during the pandemic?
Oh, absolutely. And this is everywhere you go, right? This isn't, and I'm sure this is on everybody's mind. How do we make sure that we are able to accommodate best practices as far as social distancing and still provide best clinical practice and best emotional support? Sober living is critical, right? So our CDC guidelines, in that sense, we have to ensure that everybody is practicing hand hygiene, which is really great because now we know all the people who didn't wash their hands after they used the restroom based on the amount of hand soap that was sold and who was stockpiling it. So now we know. We can really narrow that down quite a bit. So hand hygiene, things like making sure that people aren't sick. So when we have people who come in to either sober living or treatment, we do a basic assessment like, can you hold your breath for 10 seconds without getting shortness of breath? That's one really easy way to tell if you have symptoms of any kind of respiratory infection. And the CDC guidelines kind of break it down into that. We also look for, have you had a cough? Have you been exposed to anyone with coronavirus? Have you had other symptoms, fever? We're taking temperatures, we're socially distancing. We literally pull out our tape measure and we measure 6 feet away. So if we're going outside to do an outdoor meditation, our clinicians will go out there with our big, ridiculous tape measure. It's kind of like the comical one. I wish I had brought it for a prop because it's really entertaining. But they literally bring that with them and they measure out 6 feet so that every one of our clients, every one of our residents are practicing the social distancing. That is the number one absolute best thing you can do to mitigate risk of exposure, is to make sure that you are basically not touching anybody else. So we're utilizing that. And as guidelines come out from NAR, National Association of Recovery Residences, as guidelines come out from the Colorado Department of Public Health and Environment, we're updating that as they go. So we're on our third generation of policy and procedure for sober living and for our treatment staff. It's pretty cool as far as what we're doing. We're the only people who are still utilizing the building. So we are doing the 75% less. And that's what we're imparting onto our clients as well, is 75% less exposure to other people. Because the best way to stop socially isolating is to avoid everybody for 2 weeks, and then we'll move on to the next thing. The other piece that we really are super highly focused on is the mental health piece. This is super rough, right? Because when I came into recovery, the number one thing that I did was I would go to meetings and I would hug people and I would plug in and I'd go to Village Inn and get that pie after the meeting, free pie Wednesday. You know what I'm talking about. And that was how I got into recovery. I literally ate pie for 6 months and I was good. Not good, but you know what I mean. So this is taking a huge mental health toll on people who are struggling with their recovery. So what we really are focusing on is how can we practice social distancing without social isolation? Because it's so hard. And when we come in and we're like living in a state of social isolation, it's really, really difficult to change our mindset without actually practicing it. So that's like a huge part for us, is how can we make sure that everybody we come into contact with, everybody we treat, is getting an experience and an opportunity to be mentally well. So even though a lot of our program is virtual now, we still offer on-site services, because that is so critical to these early recovering folks. But again, we're constantly, like, it feels like every day something new comes down, and I'm like, okay, well, let's do this now. Let's do this now. As you can see, we're not even in the same room. We're not even in the same building, basically.
Right.
And we're all working together. So,
Yeah. So Jordan, do you want to speak to that? You guys, Choice House, for those who don't know, Choice House has a structured sober living similar to Mile High up in Boulder, Colorado. You want to go ahead and talk a little bit about what you guys are doing?
Yeah, so I mean, it's a lot of similar stuff, right? Any of the CDC guidelines that are coming out, OBH, Boulder County. For us, it's interesting because we have a 90-day residential program, and then a structured sober living program, and a lot of our guys move through our continuum together. Right. And so once they get over from residential, we have 10 sober living homes that directly neighbor each other. And then we have a clubhouse, right, kind of right in the middle of that. So it's a community, right? It is not spread out. And so working with our guys around, exactly what Sarah's talking about, how to continue to connect, but also stay safe. And the reality is, for my guys, it's a pretty young population, right? But of course, like, our objective is that we're not out spreading it around, to other folks, and just trying to be a part of the solution instead of the problem. But it's been tough, right? I mean, it's been tough, no question. And sober living, there's just only so much social distancing that you can do, and we've got 5 or 6 clients that have been furloughed from their jobs just in the past week, and so now creating programming during the day, right, for them, because it's torture for someone in early recovery, especially if they're in our continuum and have just spent 90 days in residential treatment. They're starting to gain some of this autonomy back, and really just emerge out into the world like they're supposed to. And now we're having to kind of pull that back. And so just working with them, right, daily on self-regulation, staying grounded, that's really the key, right? Because the reality is they're scared, and my guys will never say that. They'll puff out their chests and just do more pull-ups and push-ups and say everything's fine, right? But when we really get down to it and we talk and connect and we get vulnerable, there's a lot of fear around what does this look like going forward, right? And in my recovery and my family. And so just having the space to process everything that's happening. But yeah, it's an interesting time to be a provider, for sure.
Yeah, like for myself, I think initially, and I hate to admit it, but I was annoyed that we were losing freedoms, right? And then I went into work, and I work with people that I like and that I love, and I was really grateful to have a job. So I went from being annoyed to like really grateful that I could continue to do what I do. And so we get to connect in that way at work. And, we have sanitizer and, the Clorox wipes, and we're taking as many precautions as we can. And I think what we're supposed to do. And I think the biggest challenge is keeping the clients entertained and maintaining their recovery, and their whatever their program is. And so, Jill, I wanted you to speak to that a little bit, because you're the program director at Mile High Sober Living. What are they doing? How are the clients doing it? How do you maintain the, the vibe, the culture?
Yeah, so I think that each house has got their own little thing going on. You see a lot of like food bringing people together. Got women's houses cooking meals together, and then it kind of forms into this, binge watching 90 Day Fiance, at one house. One of our men's houses is playing board games every night. One of our houses is right next to the community center where they can go play ping pong. So I think each house has its own thing, but one of the most amazing things that I find every Sunday night, I'm at all the houses, checking in with the houses, kind of how they're doing. And week after week, I'm excited to see that they're doing pretty good. I think one of the things that we're focusing on a lot is that being alone in this fear is scarier than being together and going through this together. And I think that's kind of holding people together. One of the really awesome things I was hearing last night too is how many of our residents who are also in our treatment center were looking forward to Monday to get to group and to be back with other people. So yeah, doing great in the houses.
Good. So
I just wanted to say, our client said, I've never been so excited to come to group before.
Yeah. Well, you get to do something. You get to connect with other people, right? It's a different vibe when you're like told you have to stay home, and then you get to go to even to treatment. You get to hang out with your peers. So so I know I've heard some treatment centers say that if one person gets sick, they are going to stop taking people and they're going to quarantine everybody. And then after the last symptom, wait 2 weeks. Do we have a plan like that? We've been lucky that no one's gotten sick.
I think a lot of our plan is everybody who comes in is socially isolating for the first couple days, just really minimizing interaction with other people. And then we have a plan for anybody who gets sick in the sober living to quarantine them away from each other. I think at this point in time, there's no plan to really stop allowing people to get the treatment that they need. And if anybody does get sick, they will absolutely be quarantined and they won't come to group until they've had 14 days of symptom-free, right? I think with the amount of social distancing we're doing and literally the extreme precautions we're taking, our risk of really having to go all the way to not allowing people to come and get help that they desperately need that will save their life is a little extreme for us. So if that's what it comes to, I hope it doesn't, and I don't think it will. I foresee us being able to really manage that risk pretty well because I think we are the only people who have the ability to actually have a quarantine house for sick residents.
Yeah, we're lucky. We have a whole separate house with single rooms and actually a separate apartment in case we get somebody sick. They can quarantine there. Have you guys had anybody sick, Jordan?
We haven't had anyone sick, and we haven't had anyone with symptoms. Anyone who's had any kind of cold, right? Because allergies are starting to kick up. So, there have been a couple moments where I, thought someone was sick, right? And it's a cold, or allergies. So we have that going on too. But we're in the same boat, right? We've got 2 units that I'm just keeping empty right now, right? Yeah. That we'll be able to. And all of our houses are private bedrooms, so it's 3 to 4 guys in each house, which helps quite a bit, just as far as the distancing goes. But we have these units that are ready, here at our sober living, and of course, following all the admissions policies and procedures that we've put in place and have had the consultation from the appropriate medical folks. So yeah, we're still here, right? And we want to be here when people really need us to be here. So at the residential, it's a little different for us, but we have the ability to quarantine there as well. So I just feel lucky, right, that we have space and that we're set up the way we are, and that you guys are too, because I know a lot of sober living providers out there that have one home, and like this isn't an option, right? And they're still trying to bring guys in who need to be there, and are facing some real challenges around it. So, my goal is to, right now, it's, like Sarah said, it's shifting every day, right? And so we have to be able to roll with what's happening, and try and find the ways to make this work for people.
Right. So Ruth had a question. Did you see the question, Sarah? Ruth Reinhardt. She owns Sober Living out in Lakewood. She said, do we have enough staff? Yeah, you did.
So I responded. We've actually hired 2 additional staff, behavioral health technicians, to help support, because burnout is super real. And that is a great question, because we're all super stretched to the limit, right? It turns out that us being quarantined makes much more work for the staff, which is exciting and fun, but also super stressful. It's really easy to get burned out. So we've actually been doing like self-care days, self-care threads, where what are you doing to take care of yourself today? How can you unplug for an hour today? And it's hard as far as like staffing, because there are staff who are super afraid.
Yeah.
There are people who are high risk.
Yep.
And sometimes it's real easy to get caught up in that fear too, right? Because this is like global fear. It's like a snowball rolling down the mountain. Like, we can either get sucked into the avalanche of fear, or we can become leaders and exhibit those spiritual principles that are so difficult to learn. And that's kind of what we're doing. And part of those spiritual principles is like, how can I take care of myself today? And how can I model that I am doing the best to stay physically healthy and well, right? Because if we get sick and we're not taking care of our mental wellness, and we're not taking care of our physical wellness through like eating healthy and unplugging and self-care, then we're going to get real sick, and that's just kind of how it goes. So long answer short, yeah, we're working on more staff to support the stretched thin part of the staff we have now.
Yeah, I think one of the biggest challenges is that a lot of people who were working are now not working. And obviously that's not unique to people in sober living, but it's gonna affect us as a business. It's already affecting us as a business, is that they can't work. So what about like meetings and community meetings and recovery meetings? I know a lot of our house managers and a lot of the residents are on Zoom meetings, right? You guys using those, Jordan?
Yeah, so we're participating in Zoom meetings. Our guys in both of our programs are. I might get in trouble for saying this, but we are still holding small 12-step meetings for our guys in person in our sober living. And I was with them last night just to speak to what Sarah's talking about. A lot of what we talked about last night is like, we talk about living in principles, not personalities. And while what's happening is horrible, it's like, this is also an opportunity, right, to really start to practice some of these things in our lives, right, as we show up in the world in early recovery. And as I show up, right, like in, with 10 plus years, I have those same reactions. And so I need to be doing the same stuff that they are to take care of myself. So we're utilizing the Zoom meetings without a doubt, and we are still trying to have just very small meetings as well here on site, just for our clients, right? Yeah. And a few staff who have kind of committed to running those, just to minimize, obviously who we're bringing on our campus. We're staggering shifts as well, so doing everything we can.
Yeah, we're doing the same thing. Any meetings are 10 or less people, right? So we're keeping them in the house. So yeah, I think that's it. You got anything else to say, Sarah?
Stay safe out there. And I think I speak for everyone on this panel. We are all here to support you, whether you're a resident, a client, whatever, because This is like a badass group of recovering people that we have sitting on this group. So reach out. Literally, if you're feeling overwhelmed, if you're feeling like mentally unwell, please reach out. You do not have to get loaded over this or anything else ever again.
Everyone call Sarah.
867-5309 is my number. Call me. Don't call me. Call Jill. Jill loves to talk to people who are suffering or struggling.
Guilty.
Guilty. It's her favorite.
All right. Well, thanks everybody for getting together and talking about this. Do you have anything else to add, Jordan?
No, just grateful to be here. And again, yeah, whatever we can do to help other providers, folks struggling, anyone in recovery, man, we're just here to pick up the phones and talk. So glad to be here with you guys. And honestly, I mean, there's strength in numbers, right? We're all separated, but just being, spending a little bit of time with you guys today, like, it helps me, right? It brings me down a notch. It gets me grounded again and just brings me back to, okay, what are we actually doing here?
Sure.
Right? Why are we doing this in a time that I can start to spin, pretty fast as the world is. So I'm grateful to be here with y'all.
Yeah. Great. Thanks a lot.
Thanks, guys.
Thanks.